Today, a hope of many years' standing is in large part fulfilled. The civilization of the past 100 years, with its startling industrial changes, has tended more and more to make life insecure. Young people have come to wonder what would be their lot when they came to old age. The man with a job has wondered how long the job would last. This Social Security measure gives at least some protection to 30 million of our citizens who will reap direct benefits through unemployment compensation, through old age pensions, and through increased services for the protection of children and the prevention of ill health. We can never insure 100% of the population against 100% of the hazards and vicissitudes of life, but we have tried to frame a law which will give some measure of protection to the average citizen and to his family against the loss of a job and against poverty-stricken old age. It seems to me that if the Senate and the House of Representatives in this long and arduous session had done nothing more than pass this security bill, Social Security Act, the session would be regarded as historic for all time.
Welcome back to another class session on the history of the U.S. labor struggles. If this is your first time joining us, this series aims to provide some insight on current labor issues by looking back on the historic struggles and tactics inflicted upon the American working class. I am your host and Dean of Freedom University, Aaron Stockton. This session will conclude our preamble, which will act as an introduction for a 1991 National Institute of Health study on healthcare's link to employment. The crises that Americans faced during the 1930s and 1940s parallel the crises we are facing in 2020. Environmental calamity, economic collapse, and a major world war, all after just coming out of the First World War and a flu pandemic that decimated 1/3 of the world's population. I believe the topics covered in this preamble will serve as an example of the radical legislation and initiatives needed to help the people of the U.S. ensure their and the nation's survival in times like the moment we're living in right now. The entirety of this preamble will focus on specific New Deal legislation implemented by the late President Franklin Delano Roosevelt. I have released the full recordings of his fireside chat, and excerpts will be presented as part of the production of this series. I would like to invite you to the People Class Podcast Patreon, Twitter, SoundCloud, Anchor, and Facebook pages to download and listen to the recordings in their entirety. In part one of this preamble, we were introduced to the New Deal Act of 1933, which gave us the NRA, the National Recovery Administration, Public Works Administration, the Civilian Conservation Corps, the Civil Works Administration, the Farm Security Administration, the National Industrial Recovery Act of 1933, and the Social Security Administration. In part two of our preamble to how and why healthcare became linked to employment, we briefly examined the U.S. government's role in regulating prices in the economy, and the laissez-faire style of government adopted from an 18th century French economic ideology, which led to the very necessity of government intervention. They always yell small government from the mountaintops until they have squandered away their finances and beg Big Daddy government to come to the rescue. Like an entitled, upper-class college student who squandered away their trust fund, then returned home to make amends with his mommy and daddy and obtain another refill. I am sure you've noticed a repetition here, wondering if I got lost somewhere in scribing the session. It was done to highlight the repetition, a vicious cycle, if you will. The recessions, depressions, and economic crashes can almost be timed to a watch. Richard Wolff quotes around every 4 to 7 years there's an economic crisis in the U.S., yet the elite corporate class are adamant to maintain a system with such a flagrant and proven flaw. And even more tragic is the virtually willful subjugation of the many uninterested working class Americans who claim no stake in or care to invest any of their mental bandwidth to politics. Sadistic is the term I would give the oligarchs' fixation and devotion to such a nihilistic and self-defeating practice. Getting off my soapbox here, in today's session, I want to steer our conversation toward healthcare in the U.S. More of this topic will be covered in the study I will present in its entirety, so feel free to use this as the Cliff Notes or the TLDR, too long didn't read portion of the National Institute of Health study that will be presented. Be sure to listen to part 1 of this preamble to how and why healthcare became linked to employment. We briefly examined the job creation initiatives FDR implemented in his New Deal, which proved a successful attempt to not only stimulate the waning economy, but to also restore the dignity of those most affected by a period of a simultaneous ecological crisis, the Dust Bowl. I also reminded you of a 1918 influenza pandemic that inflicted the nation and the world just 10 years prior to the fated stock market crash of 1929, and World War I that terrorized the world for years prior to the pandemic, lasting from 1914 through 1918. There is no doubt the early decades of the 20th century were very tumultuous times. Well, in order to understand where and how our current healthcare system came to function as it does, we must take a journey back to 1929, in which, much like today, the failures of for-profit capitalist system, which directly caused economic catastrophe, coincidentally at the time when the U.S. was experiencing an ecological disaster. Keep in mind, once again, the world was just only recovering from the 1918 flu pandemic. And just a quick side note here, until 2019, the CDC called the 1918 H1N1 influenza pandemic, which was coined the Spanish flu, although originating in the United States, out of Kansas. An estimated 1/3 of the world's population fell ill to the virus, roughly 500 million people, and 10% of that population died from infection, and that was roughly 50 million people. In the midst of this pandemic, an estimated, I'll say, 675,000 Americans contributed it to that figure. The response was handled then in the same way the response was handled as it is right now. This is literally a case of deja vu. Looking at the pattern of capitalist economic depressions that follow social turmoil in the U.S., and being mindful of the blatant predatory run on the U.S. Treasury and the American working class during the 2008 housing market crash and the 2020 COVID-19 pandemic crash, in which corrupt government leaders decided to funnel money up to their elite circle instead of to the impoverished working class who were left hanging in the wind. How was healthcare handled before the Great Depression? A brief history, universal healthcare efforts in the U.S. This is an article that you can read on www.pnhp.org, a brief history, universal healthcare efforts in the U.S. I'm going to give you some transcription notes here. This is regarding how healthcare was handled before the Great Depression. Most of the developed world started with compulsory insurance, compulsory meaning that it's obligatory, required by law, that eventually ushered in a national health insurance program. And this is around the world, not in America. Between 1883 and 1912, Germany, Austria, Hungary, Norway, Britain, Russia, the Netherlands, Sweden, Denmark, France, and Switzerland were the first to offer and provide compulsory insurance to workers. And this was for the benefit of protecting the worker from wages of loss due to sickness. They subsidized the mutual benefit societies that workers formed amongst themselves. So just like right now, how we have mutual aid funds building up to, as working class, average Americans, coming together to raise funds and help their brothers and sisters out there. They're their fellow countrymen. That this is one of the ways that healthcare was handled before the Great Depression. The U.S., on the other hand, has offered no subsidies whatsoever in any of those efforts. So much like today, the U.S. in its laissez-faire approach to government had no interest in working class social health insurance. Ultimately, they left the matter and burden of national health care to private industry and voluntary public programs. We see how that has gone. Teddy Roosevelt publicly supported health insurance, but took no legislative action towards offering such a system for the Great Depression. The American Association of Labor Legislation, a progressive capitalism reformist group, petitioned and campaigned for health insurance on behalf of the working class in 1906. Another struggle that we have not overcome yet. Past, 5 years, demanding a $15 minimum wage. With the cost of inflation, that's now a $20 minimum wage. In 1906. In 1915, the AAL formed a social welfare committee that drafted legislation for a health insurance program that solely covered the working class and those earning less than $1,200 a year. Now, if you read my National Working Class Labor Union mission statement, this is identical to what I call for. I say if you make under $100,000 a year, you should be covered. This is the first time I've seen this information, which was in preparation for presenting this topic. Why are we still having this conversation? Before the Great Depression, the services of physicians, nurses, and hospitals were included, as was sick pay. This is an health insurance program that was drafted here by the AAL. The services of physicians, nurses, and hospitals were included, as was sick pay, maternity benefits, right? We're talking about 1915, and a death benefit of $50 to pay for funeral expenses. Wow. Costs were to be shared between workers, employers, and the state. This was an amazing, progressive piece of legislation that was written 100 years ago now. 2/5 of the costs of this healthcare program would come from the workers, 2/5 from the employers, and 1/5 from the state government. The American Medical Association supported this legislation proposal. Some physicians who were leaders in the AMA wrote to the AAL. Once again, that is the American Association of Labor Legislation. They wrote to this organization, "Your plans are so entirely in line with our own that we want to be of every possible assistance." The American Federation of Labor and Private Insurance Industry opposed the American Association of Labor Legislation proposal to cover the working class. The argument was made by both entities that such legislation would have weakened their competitiveness by way of collective bargaining and services rendered, respectively, funeral expenses in particular for private insurance agencies. Just like today, there's always been large groups with money and influence who keep these necessities, these benefits away from us, which should be just human rights in America. Overall, the pursuit of a national or universal healthcare system was crushed by private industry, much like today. And ironically, unions, which would have benefited the working class the most, as a matter of my opinion, would have forced unions to innovate and create a competitive advantage, I think. It's crazy to think that unions would oppose such pro-worker legislation, but it happens. So on the topic of healthcare in the U.S., the New Deal legislation did offer limited national health insurance coverage, and this was in the form of Social Security insurance. President Roosevelt's 1934 Committee on Economic Security, that's CES, the original incarnation and would-be predecessor of the Social Security Act of 1935, SSA introduced the first Medicare program to the U.S. According to SSA.gov, this was an act to provide for the general welfare by establishing a system of federal old age benefits and by enabling the several states to make more adequate provisions for aged persons, blind persons, dependent and crippled children, maternal and child welfare, public health, and the administration of their employment compensation laws, to establish a social security board to raise revenue and for other purposes. This is what the Social Security Administration was tasked with, the inception of the Social Security Act of 1935. Visit the website for an extensive breakdown of each title of the Social Security Act, which is still functioning today. That is at www.ssa.gov. So health insurance was dropped from the Social Security Act of 1935 on the basis that it would double the payroll deductions. We're hearing about payroll taxes again, right? 2020. In other words, increased taxes that would burden the employer. So as a compromise, the Committee on Economic Security opted to provide limited support to state public health programs. You see how that has turned out. Early in 1935, the minimum wage in the United States was based on the National Industrial Recovery Act of 1933. Part of the New Deal legislative efforts to combat the Great Depression, NERA authorized a weekly minimum wage of $12 to $15 and a maximum work week of 35 to 40 hours. It basically costs a week's worth of labor back then to cover your medical expenses for a whole year. Like, imagine if 1 week of your monthly income covered everything you ever needed medically for a year, your copay, your prescriptions. It's a shame that a lot of this stuff was gutted. We'll get into the nuts and bolts of the Social Security Act along in our study. But there are some glaring holes with the Social Security Act. It excluded and alienated agricultural and domestic workers, which amounted to roughly half of the U.S.'s working population at the time. Domestic worker is just a sanitized term for personal service worker, butler, servant, you name it. They performed whatever duties were needed, including but not limited to cleaning the house, washing, ironing clothes, taking care of children, elderly or sick members of the family, gardening, guarding the house, driving for the family, or pet sitting. And this is according to the International Labor Organization website. Why exactly is it that the agricultural and domestic workers weren't covered by the Social Security Act of 1935? Were they like the essential workers of 2020, the healthcare workers and grocery workers? In a sense, yes, but not in the context you may think. What you have to understand here is that these labor sectors were intentionally excluded. Why, once again, would anyone be excluded during the worst economic crisis to befall the U.S. and the campaign to recover from said crisis? It all comes to that institutional racism again. The personal service, aka the domestic worker industry, was predominantly held by Black people in America. It seems like no matter where you look in American history, you cannot escape the prevailing and relentless staple of good old-fashioned racism. But as the Marxian economist Richard Wolff, that's Wolff with two F's, often points out, the African American or Black community has always acted as a shock absorber for the failures of unfettered capitalism. So we're not going to perform a deep dive into each individual title of the Social Security Act today, but we will revisit it in future sessions. Just looking once again at some good faith efforts, we had some proposals for national health care insurance during the Depression and post-war years. So there are attempts to bring nationalized healthcare into the conversation during the Depression and post-war years, and much like today, the conversation was typically shut down before it could even start. The Wagner Bill, National Health Act of 1939, drafted by the Tactical Committee on Medical Care, established by FDR in 1937, gave general support for a national health program to be funded by federal grants to states and administered by states and localities. The Wagner-Murray-Dingle Bill of 1943 adapted its proposal to provide compulsory, which once again that means obligatory or required by law, compulsory national health insurance, along with a payroll tax. Ultimately, the bill never passed due to powerful union and private interests lobbying opposition 14 consecutive years. I'm sure when they started talking about payroll taxes and further costs to private industry, that once again, like today, it gets shut down immediately. Status quo. In conclusion, in short, a group of lazy, entitled, predatory, opportunistic, sadistic, nihilistic, narcissistic, sociopathic capitalists learned how to infiltrate a civilization's governing power infrastructures and rig the economy to work in their favor. Unfortunately, virtually as soon as we began to see the oasis of economic recovery, most of the programs implemented by the New Deal were dismantled, like almost immediately, within 3 to 5 years. Social Security has managed to hang on by a proverbial thread for this long. It has always been under attack of defunding and has essentially been gutted tremendously, especially since the Reagan administration of the 1980s. So I just want to highlight a point I made in the first part of our preamble here. Until we reform our healthcare system and untether it from employment in times of economic crisis, such as the current one we're in, caused by the coronavirus and the looting of the U.S. Treasury and the American working class, the U.S. government has in the past and should currently an FDR New Deal style program or programs to not only shore up but ensure the social security and stability of the working class for generations to come. Inaction on this kind of social safety net legislation has only proven to further deteriorate the economy and society, while New Deal legislation that gets the masses back to producing within living wage income jobs regulates the greed of private industry and redistributing wealth amongst the most vulnerable has been proven to facilitate a prosperous economy that benefits the whole of society and not just the few. So this concludes my preamble to a 1991 National Institute of Health study that I would like to present to you with commentary titled Employment and Health Benefits, A Connection at Risk. This will be a different format than what you're used to, but I feel the report warranted revisiting, especially now. Cries for Medicare for all, and once again, the government wants to crunch numbers and have numbers and statistics for all the reasons why you can't have health care or a job right now or housing. In my research on why healthcare is linked to employment, I found most of the statistics presented in the study have remained fairly stagnant. The study highlights the relentless, insidious status quo problem the United States has been afflicted with since its inception. It should be some interesting stuff. I hope it is of some value. I hope it helps to really kind of open up a lot of people's eyes, especially maybe some of the generations who probably hasn't really noticed the decline in their quality of life, and I don't know how they haven't in the past 40 years. Well, certainly the past 20 years, because I've definitely seen it. But anyway, this was your host, the Dean. You have been listening to another class session presented from the sprawling campus of Freedom University. That's Freedom University, or FU to the corrupt politicians out there. Enjoy the rest of your day, and thank you for tuning in to another session of the People Class Podcast, the official podcast of the People Class. I hope you found the information shared in today's session enlightening, or at the very least, raise some questions. I extend an invitation to join us for more weekly sessions. And remember, our work does not stop here. Get active, organize, and take control over your destiny as an American working class person. Class dismissed.
Support the unions and long live Wisconsin. It's not the left, it's not the right. It's up and down and that's the fight. It's a world of new hope.